I sometimes reminisce about how it all started. The roads I ride today look very different than they did then, over 30 years ago. I became familiar with Middletown because of the time I spent in Sullivan County as a child. My grandparents were in the bagel business in New York City and established a bakery in Monticello. The entire family helped out. I spent virtually every summer in Sullivan County and often traveled through or to Orange County. After training and practicing at Memorial Sloan Kettering Cancer Center, I decided to leave the city and was drawn back to Orange County, where I established my own medical practice in Middletown in 1982. It was then I met my wife, Jennifer. Her family owned a dairy farm in Otisville. After we married, we bought our own dairy farm in the town of Wallkill. Jennifer and I milked the cows, delivered the calves, and made the crops. And at the same time, my medical practice grew and thrived. Back then, Orange County was more rural. The area was growing, but many of the services we take for granted today did not exist. Healthcare, both here and elsewhere, was fragmented and uncoordinated. The healthcare system was not working as it should, and patients were paying the price. Yet there was more complaining than action by healthcare leaders. It was clear to me that physicians have a unique role to play as advocates of patient welfare, that serving in that role is a professional obligation, not an option, and that the obligation does not begin when one enters the exam room, but instead requires that physicians help create and be part of a high-value, sustainable healthcare system. With that in mind, in 1996, my partners, Dr. Robert Dinsmore and Dr. Manuel Perry, and I started Crystal Run Healthcare, a multi-specialty group medical practice that put primary care physicians, specialists, and many other healthcare services under one roof. This model was radical in many ways, most significantly because it empowered patients to demand better care and empowered physicians to provide it. This new model encouraged doctors and staff to communicate and to work together as a team to benefit patients. At the same time, it caused other healthcare providers in the region to up their game. A good result for all. Over the last 20 years, we have grown significantly. Today, Crystal Run is one of the fastest growing medical practices in the country and one of the largest in New York. What started as a single office in the town of Wallkill has grown to be over 30 locations in Orange, Sullivan, Ulster, and Rockland counties, as well as Manhattan. We have more than 400 providers and over 2,200 employees. We have garnered a reputation as one of the most progressive medical practices in New York and the nation. Our list of regional, statewide, and national firsts, including unique accreditations, certifications, and other recognition, is substantial. Most importantly, we see our product as better health outcomes, not what we do to patients, but rather what we accomplish for patients and for the communities we serve.
I was the 9th physician to join Crystal Run when I came here in July of 1996. It was actually the only job interview I went on. I met Hal. I had one kind of long conversation with him, but his vision, his passion for doing what's right, changing the status quo, his vision for a new model of healthcare delivery, I knew right away that this is where I wanted to be, that this is where I belonged. I thought I was just looking to practice medicine, but Hal's vision was something completely different, a whole new model of healthcare delivery which made perfect sense. He exuded a passion for doing what is right and for changing the status quo. I saw Hal's vision and commitment and his passion that day, just as I see it every day since. He has provided me and so many others countless opportunities to be our best selves, to help others, and to improve the quality of life for so many. 20 years later, as I look back, I wouldn't have done it any other way. Hal's vision and leadership is Crystal Run. We would not be where we are today without Hal Teitelbaum.
Winston Churchill said, "To improve is to change. To be perfect is to change often." We are far from perfect, but we understand the status quo is the greatest risk. Change is one of the few constants at Crystal Run. Our newest facility in Newburgh, like those under construction in Monroe and West Nyack, represents a further enhancement of our model, creating an improved patient-centric experience while encouraging collaboration between clinicians and staff. Our new architectural model is a metaphor for the cutting-edge innovation occurring at Crystal Run and has focused additional statewide and national attention on the work we are doing in Orange County and the Hudson Valley. My partners and I truly appreciate the trust our patients have put in us over these past 20 years. It's been quite a journey and one that continues today. And we appreciate the support and trust of elected officials, municipalities, community institutions, businesses, and the community at large. We at Crystal Run have a lot to be proud of and a lot to be thankful for. While we have invested in the region has also invested in us. In particular, we thank Orange County and the Hudson Valley for the opportunity to serve, to grow, to thrive, and to help lead positive change in healthcare. The region has also provided us, all of us, our staff, our physicians, our partners, and all of our families, a quality of life that is second to none. Just as it is our mission to improve quality of life through the healthcare services we provide, we enthusiastically support the Orange County Citizens Foundation for its contributions to Orange County's quality of life. On behalf of all of the partners and employees of Crystal Run, I thank the Orange County Citizens Foundation for this honor. I am humbled to be so recognized.